The Commission on Excellence and Innovation in Health was formed to meet the challenges of modern healthcare, to reimagine the systems required to deliver excellence and to embrace the innovations that modern science is bringing to the delivery of healthcare throughout South Australia. Here at the CIH, through Informatics, through partnerships and through human-centred design, we have been given the opportunity to put people back at the centre of healthcare to improve the experience and outcomes of the South Australian community.
We are all about bringing people together to reimagine a health system where people are truly at the centre. We're doing that by building capability, by providing advice and support, by partnering and connecting, bringing people together, and also by looking at opportunities for best practice in innovation and best practice evidence. We are co-designing solutions where there's a problem that's been clearly identified, not with one or two parties that are involved in the process, but with everybody that's involved in the process. And our role is bringing them together. One of the ways that we do that is through networks. We have statewide clinical networks which are about forming a structure to bring those communities together.
The 8 statewide clinical networks operate within the CIH. Each network has a network advisor that works really closely with them to make sure that they can achieve the impact that they want to have and the vision and the aims and the strategic projects that they are trying to execute. We support the clinical networks by providing them with access to particular skill sets and resources here at the CIH, whether that's problem framing or project management skills, access to clinical informatics data team, or human-centred design approaches to help them move their projects of work forward.
What we're looking to develop is leadership. We're looking to build skills in clinical informatics because we know how important insights and information are to being able to choose when we're looking at opportunities to improve and to innovate. And we know that it's really critical for people to build skills in human-centred design and being able to bring everybody who's involved in the process together to redesign the system.
Partnerships are central to reaching our vision of better healthcare for South Australians. Partnerships not only help innovation to flourish, but they are the best way to address the complex challenges that our health system is currently facing. We'll work to break down those barriers that make it hard for our health sector to partner. CIH wants to partner with a diverse range of organisations. So if you want to make a difference to healthcare in South Australia, we want to hear from you.
With the emergence of artificial intelligence, with new devices and new technologies, combined with the more complex and diverse needs of our community, the opportunities faced for delivering better healthcare are abundant.
The clinical informatics team is all about data, how we create a data-driven health system, how we deliver health insights to the users of the health system, whether they're clinicians, the consumers, or carers, or the community. We have the team with the skills and expertise, understand the health data and understand how to bring that together to tell the data story, to do the visualisation and deliver the insight. There's so much rich data assets out there, and really we need to maximise the potential of those. We will continue to build the picture for the statewide clinical networks and to partner with those who share our vision of an insight-driven health system.
Our team of experts, of clinicians, of data scientists and informaticians, of project managers and system redesigners are well placed to empower the delivery of improved healthcare for all South Australians.